Did you know a single documentation error can cost a pharmaceutical company millions? That's why the new draft of USP General Chapter 1029, Good Documentation Guidelines and Data Integrity, is a game changer. Released in July 2025, this draft marks a major shift in how pharmaceutical records are managed. It's not just an update, it's a call to action for the entire industry. The focus is on a life-cycle-based approach to data management, moving beyond simple record keeping. Regulatory bodies like the FDA are demanding more reliable, trustworthy data than ever before. This chapter provides a clear roadmap for achieving data integrity, from creation to archival. At Pharmalytics, we're here to break down what these changes mean for your daily work. Understanding this draft is essential for anyone in pharma, because robust documentation protects both your company and your patients. Let's dive into the key changes and what they mean for you. USP General. Chapter 1029 sets the standard for good documentation practices in pharma. The 2025 draft expands its scope, putting data integrity front and center. It now covers the entire data lifecycle: creation, review, use, and retirement for both paper and electronic records. The chapter's new focus: ensuring data is complete, consistent, and accurate at every stage. It also harmonizes documentation practices across the industry, making compliance with global regulators easier. The expanded scope now includes raw data, metadata, audit trails, and records from manufacturing to distribution. This comprehensive approach makes USP 1029 indispensable for any organization committed to quality. In short, it's the new gold standard for pharmaceutical documentation. If you work in a GXP environment, you know ALCOA: attributable, legible, contemporaneous, original, accurate. These principles are the foundation of good documentation. Over time, ALCOA evolved into ALCOA Plus, adding complete, consistent, enduring, and available. Now, the 2025 draft introduces ALCOA++, traceable and secure. Traceable means every data point can be tracked from creation to final disposition, with robust audit trails. Secure means protecting data from unauthorized access or changes, crucial in today's digital world. ALCOA++ is a direct response to increasing digitization and regulatory scrutiny. Companies must now build systems that track every interaction and safeguard data integrity. Embracing ALCOA++ isn't optional. It's essential for compliance and patient safety. The future of pharma documentation is about more than accuracy. It's about total control and transparency. Are your systems ready? The new USP 1029 draft is organized for practical use, covering both paper and electronic records. It details best practices for everything from indelible ink on paper to cybersecurity for digital systems. The guidelines apply to all GXP records: batch records, lab notebooks, analytical data, SOPs, training records, and more. Metadata, like timestamps and user IDs, is now as important as the data itself. The chapter emphasizes a comprehensive approach: every document, every format, every stage. It also highlights the need for formal data governance and a strong quality culture. Technology alone isn't enough. People and processes matter just as much. The message is clear: robust documentation is everyone's responsibility. What does this mean for your daily work? Lab analysts must record data as it's generated, no more end-of-day catch-ups. Quality assurance teams will review audit trails, not just data accuracy. Manufacturing operators will document every step, with traceability and security built in. Electronic systems will become the norm, offering real-time controls and audit trails. Audits will focus on data integrity, so being audit-ready is a must. Regulators will expect robust data governance and proof your data is secure. The new USP 1029 draft is your blueprint for building a defensible data integrity program. Adopting these guidelines means building trust with regulators and with patients. The draft isn't final. It's your chance to shape the future. USP is accepting public comments until November 30th, 2025. Review the draft, assess your organization's practices, and submit feedback. Use this as an opportunity to conduct a gap analysis and strengthen your systems. Raise awareness, train your teams, and foster a culture where everyone owns data integrity. Staying proactive is key. Don't wait for regulations to catch up. At Pharmalytics, we'll keep you updated as USP 1029 evolves. These changes are your opportunity to lead in compliance, quality, and patient safety.